This is a pedicle screw. Pedicle screw is the most important implant in spine surgery. This is used in virtually all cases of spine fixation, fusion, or deformity correction. So how does this work? This screw is passed from back of the spine till it reaches the front of the spine. That is, it crosses from back, middle and front, which gives a very strong fixation of the vertebral body, and then the multiple screws are joined with a rod and we are able to fix the segment of the spine. What makes this implant so successful and so effective? Pedicle screw is perhaps the most important invention that we made in the evolution of spine surgery implants. So previous generation implants were fixing the spine only from the back. That would often lead to implant failure. But pedicle screw is able to fix the back, middle and the front compartment of the spine, thus giving a very strong fixation than the previous implants. That helps to increase the longevity of the surgery and gives much better results. So where all do we use this implant? So for instance, if there is a fracture in the spine, we fix the segment of the spine below the fracture and above the fracture, and then we will combine that with a rod, and thus we will be able to stabilize that fracture. The second very common example is addressing the instability in the spine. So whenever there is movement in the spine, we fix that motion segment with screws and add a rod, and if you want to fuse, then we will add a cage. So that will lead to fusion of that segment. Then in deformity correction, we'll fix the bent spine with screws, and then we'll pass the rod through these specialized screws, and that will lead to correction of the bent spine into a straight spine. This implant is completely biocompatible because it is made up of titanium and it is MRI safe. Putting this screw safely into our spine is a big challenge, but if you know the right techniques, whether it is freehand or robotic or navigation, this screw provides the best results possible. If you want to know how we can put this implant in a spine through a narrow corridor with precision, give a comment and I'll make a video on it.